The vitamin D supplementation nowadays is relatively simple because the Institute of Medicine recently, that is at the end of November, had come up with a recommendation that all of us could use. Specifically, they make the recommendation based on the assumption that individuals would have minimal or no sun exposure because they recognize there are a lot of side effects with UV exposure. Secondly, by so doing, they also take out the effect of skin types because we know that individuals who have darker skin in general tend to have lower vitamin D level because vitamin D synthesis from the skin is going to be less. So by so doing, they have taken it out. So what they're recommending is that for anybody from the age of 0, that is from birth to the age of 1, to take 400 international units per day. For the vast majority of adults, which from the age 1 essentially to the age of 70, to take 600 international units per day. And then for those who are older than 70, to take 800 international units per day. And the best way to get that is through vitamin D pills. It is very inexpensive. It is over the counter. In fact, nowadays, most of the multivitamins, they contain vitamin D already. So then they contain vitamin D at 600 international units. So it's an adequate dose. The reason I do recommend taking vitamin D pill as a supplement to get vitamin D is that because through sun exposure, we all know the side effect of sun exposure, and also very unreliable because depending on the season, depending on the time of the day, it is very hard to get reliable sun exposure to achieve adequate vitamin D level. From diet, which is the other source of vitamin D, it is not a very practical source because there are very, very naturally occurring food that contains adequate level of vitamin D. Salmon, for example, has a lot of vitamin D, but on the other hand, you cannot expect individuals to eat salmon every day in order to get vitamin D, adequate vitamin D level. Most of the milk and orange juice in the US, it is supplemented with vitamin D, but again, one has to take quite a bit of it in order to get adequate levels. So vitamin D pills is still the most practical way of obtaining adequate level of vitamin D.
Now, there's a little bit of controversy about this. How do your colleagues feel about this?
The controversy, there are several controversies. One is that whether vitamin D is good for health, whether low vitamin D level is associated with diseases. It is quite clear there are a lot of what I call signal, meaning that a lot of reports of association of low vitamin D level with various disease endpoints. However, at this time, the data is still somewhat controversial or somewhat inconsistent. Because of that, in fact, the IOM, Institute of Medicine, had made the recommendations saying that these data, yes, they are out there. However, they are not consistent enough to be able to be used to make a public health recommendation. So the only piece of data that they have used to make this recommendation, and I fully agree with that, is the data on bone health, because that is the strongest piece of evidence that vitamin D is very good for bone health. The other controversy is that whether, as dermatologists, we tell our patients to do photoprotection, whether by so doing this would result in low vitamin D level. There have been very, very good analysis of data, we call it meta-analysis of information that had been published, showing that in actual use, the use of sunscreen in general does not result in inadequate vitamin D level, mainly because I think individuals do not use sunscreen adequately, and that's the main reason. Clearly, in the laboratory setting, if one applies sunscreen at the amounts that they should be applied, which is 2 milligram per centimeter square, which is the amount that is used for testing by the FDA, that amount of sunscreen would result in the suppression of vitamin D synthesis. But in actual use, that has not been the case. As dermatologists, I think we should continue to advocate to our patient for photoprotection. And this would include individuals of different skin types, because we know clearly a fair-skinned individual can develop skin cancer, but also clearly darker-skinned individual can also develop skin cancer. So photoprotection is a practice that we should recommend to our patients. For those patients who are at risk for vitamin D, low vitamin D level, such as patients who practice very rigorous photoprotection, patients who are obese because vitamin D is a fat-soluble vitamin, patients who have malabsorption, then for them to take vitamin D.